Hello, and welcome to our new episode of the Wonder Tooth Podcast. Today, we're going to talk about dental bonding. What is dental bonding? What is teeth bonding? What is bonding in general? This is a very interesting subject because bonding is not really a filling, it's not a crown, it's not a veneer, it's composite resin. So how do we do that? What is dental bonding? So dental bonding is basically application of the composite resin, the material that we use to, the white material that we are using for fillings. And we use that in very specific scenarios. It's not really to fill a cavity, but it is to still fill the tooth in a very particular situation. For example, a patient would come to me and say, my gums are receding a little bit and there is that little notch on the side and it's sensitive. So what do? I usually check, and if there is some sensitivity indeed, I would say, okay, we're gonna do bonding. But what is bonding? Is it covered by my insurance? What does it entail? So we are here today to discuss all of this and basically tells you exactly what is dental bonding or teeth bonding, and what kind of procedure is it, how is it's done, and the pros and cons, the advantages of bonding compared to some disadvantages of bonding, and how to take care of that and maintain them down the line. So first of all, bonding, as I said, is basically application of composite resin, the white filling material that we are using on your teeth. It's a very we call it the least invasive cosmetic part of the dentistry. Why? A patient would come and they chip that tiny little piece of the front tooth, very tiny, very small, and they will be like, what do? Do I need, something big? I need that fixed today. Usually, if it's a tiny chip, we usually do it without numbing. And how do we do it? We just have to roughen that area a little bit, kind of put some tiny grooves in there to be able to bond the composite to that. If the tooth surface is very smooth, the material is not gonna bond. So we need to roughen it. We call it kind of sanding a little bit. And then we put some tiny little grooves so that we can pack the material inside kind of, and then we polish it at the end to make it look like a tooth. So basically, if you have a very small chip in your teeth, you try to open a bottle, you hit it with the fork, and it's a small chip. Sometimes, even if it's a little bit of a bigger chip, I would say maybe 1/4 of the front tooth, we can still do some bonding. And as I said, it can be done on the same day. It's very minimally invasive, and some people, they can actually do it without numbing. I'd rather, if I'm gonna drill a little bit, I'd rather just numb you to be on the safe side. So what are the criteria? What is the cases that we have to put bonding, and why bonding is different than a filling? It is still a filling because we are using the filling material. However, the specifications, the scenarios are a little bit different. So this is in case, basically, first of all, if you come to me with a tiny chip in your front tooth or on the side, that's bonding that we're doing. Also, if you come to me with a little, the side of your teeth a little bit, the gum is receding and you have those tiny little notches where you can put your nail and you can feel, okay, there is a step there. This is bonding. And that's why sometimes I would tell the patient in the chair, okay, we need to put some bonding. They will go outside and it's a filling. And they're like, what is that? She told me I don't have a cavity. Yes, this is not a cavity, but we still have to put a filling there. Unfortunately, there is no code for bonding. So we have to put, and I'm talking about an insurance code. There is no insurance code for bonding because it covers a lot of things. So the code that we put, it's a code for a filling. And that's how it can get approved by the insurance. Not for everything, but the majority. If it's something small, like 2 or 3 surfaces, sometimes 4 surfaces, then we can do. What is a surface to? Okay, well, this is a good question. So the tooth, basically, it has 5 surfaces. One here, like the inside, the outside, in between the teeth, and then the biting surface. So each one of these is called the surface. So for example, if you have a chip on this side right here, so this is 1, 2, 3, and 4. Like if that quarter is broken, so that's 4 surfaces. So we have to still put it, even though it's not because of a cavity. If you cracked it, we still have to put a coat of a filling. Same thing if you have like a little on the side of your teeth, you know, where the gum is receding, we still have to put a coat of a filling. So some of the criterias now are if there is a little chip in your teeth because you bit something or something hit you, your dog hit you, playing with you, just hit you in the face. So that has to be a bond, like a little bonding. Sometimes also if you have your teeth, you have a little spacing between your teeth. And some patients are kind of scared of putting something more permanent. So they say, okay, can we just try to close the gap a little bit? Especially if you have what we call a black triangle. So the gum is receding, and then when you look, the gum is also receding in between. And then when you smile, you can see like a tiny little empty space between the teeth. So this is what we call a black triangle. It's very common to have, you know, if you have, you had some gum disease at one point, or you had some braces at one point, or your bite is off also at one point. So we can fill this very gently. As I said, we just have to sand the tooth a tiny little bit to make sure it's rough enough to basically incorporate the resin into it. So this is called bonding. So now we are talking about bonding. We can use it to fix a chipped tooth, or to close a gap, or also to put it on the side of your teeth where we have basically receding gums. And also sometimes if you have a discolored tooth, you know, some people, they have like the fluorosis and the teeth becomes a little too white or chipped. So we can do something called like a microabrasion. You know how we do microabrasion to the skin? So we do that to the teeth as well. And then we fill them with kind of a liquid resin. So that's also considered bonding. Or if, let's say, you had some root canal done and the tooth looks a little discolored in one area, so we can basically kind of remove that little layer very tight, like very gently, and add material into it as well. And also, as I said, we can change the shape of the tooth. So let's say your teeth, you have some spacing and the teeth they look very narrow, and now we need to make them a little bit wider because I need to close the spaces. I cannot just close one space and then leave the other, and then one tooth is going to look too wide compared to the other. We have to do it basically if there is, let's say, a space of 1 millimeter in the middle and 0.5 millimeter on the side here and here. So I have to divide the spaces between the teeth. So this tooth get 0.5 millimeter in between here and here. And then we also have to put like something very tiny called mylar strip, a tiny little plastic thing to make sure that you guys, after we do the bonding, that you can floss. Of course, we cannot make them one piece. Don't ever do that, ever. Don't go to a dentist who would do that too. So right now we spoke about basically what the teeth bondings are. So first, as I said, we talk about, and that's my cat actually meowing, and he's like, okay, why she's not talking to me? Okay, so we can fix a small crack or a small chip in a front tooth. I wouldn't do back teeth with it. Sometimes it can be very hard to fix a chip because your back teeth, you have a lot of forces coming down, so you have something a little bit more permanent. We can close diastema or spaces between the teeth. If you have a little black triangle between the teeth from gum disease or from braces or from the bite is off, so we can also close the gap a little tiny bit. And also if you have the gum receding on the side, and if there is a little bit of discoloration. So we can fix that. How is it done? So basically, remember when I said we still have to kind of roughen the outside layer of the tooth. How do we do that? We can sand it, like we have some special tool that we can basically roughen the surface of the tooth. I usually like to create tiny micro cracks, tiny retentive grooves all around, basically to make sure that we can push the material just to get more retention. And how do we do that? So we use what we call a mylar strip, which is it's a very thin layer of plastic that we put, and we basically kind of mold the filling on top of your tooth after we etch it. So the etch is the blue thing that you sometimes see, or sometimes it's green, and it's like an acid, and it kind of removes some of the inorganic material from the tooth to try to create micro gaps, tiny micro gaps. And this is where the bonding is going to flow in between, and then the resin is gonna flow in between as well. And this is how it can bond to your tooth directly. So now we understand. So after we etch, we apply the bonding agent, and then we start to mold that composite on top. And after that, we start to kind of finish it and make it nice and smooth, and then we polish it. And sometimes we even put a very thin layer on top of it as well to make it a little shiny. And then of course we adjust the bite and make sure you can floss nice and easy. The floss is not shredding. So this is basically teeth bonding. Now, what are the advantages of teeth bonding? Okay, the first one, sometimes we can do it without anesthetic. Yes, it can be done without numbing, sometimes even with a tiny numbing gel, sometimes not even a numbing gel. If it's very small and if it's still in the enamel, remember the enamel is the protective layer of the tooth. There is no nerve endings in there. So we can do it gently without touching the dentin. The dentin is the layer underneath it, and usually the enamel is the thickness in the back is between 2 to 2.5 millimeter. In the front is much thinner than that. So we have to be very careful. In dentin, this is the yellow layer, and that's the layer underneath it, and this is where the nerve endings are. So if I am doing a tiny chip in the enamel, we can do it without numbing. If we're going a little deeper than that, I'd rather just have you numb. But some patients, believe it or not, they don't want to be numb. And I had a patient once, he's very brave. Like, he is a very, very, very brave man. And he's like, I'm not going to get numb. What are we doing? We're doing a bridge. And I said, are you sure? I'm going to prepare the teeth. I have to shave the outside of the teeth. And he said, I'm not going to get numb. I said, okay, well, let me know. And I actually started working on it, and he wasn't feeling anything. He was an older man too, but it went great. And we did the bridge on the same day, and he couldn't believe it. He was very happy. And the best part for me as a dentist was I was able to actually check the bite. Every time we numb the patients, it's very hard to check the bite properly because they're numb and they're not biting all the way down. So I'm not saying don't get numb, but a lot of the problems afterwards that the bite can be a little bit off. So we spoke about one of the big advantages of bonding. If it's a small chip, we can do it without numbing. A second big advantage is really, it's very cheap. It's basically like a filling. So depending on your insurance or whatever, co-pays, this and that, it's very cheap compared to something more cosmetic. Like, this is the least expensive something, the least expensive process or procedure in cosmetic dentistry. It's even cheaper than whitening. And sometimes, let's say, if you want to have your front teeth and you want to have them in a certain shape, sometimes we can do something. Basically, we can take the impression or scan your teeth, and we can do like a wax try-in, like basically add, not me, obviously. I mean, I know how to do it, but I'd rather have the lab do it. They basically can add wax to kind of check in their head like how the teeth are going to look like. Then we make a cast off of this, and then we make a template, like a little plastic tray. Then we make, this is very technique sensitive now. Then we can make a tiny hole in that tray. So the bleaching tray, kind of it looks like this. It's a little sturdier though. Then they can inject liquid resin into these. And then you put them after you etch the teeth with the blue, and then you put the bonding, and then you basically inject the liquid resin into this. And then it molds according to how the teeth look like. Then you go and you finish everything and you reshape them. And this is what we call a composite veneer. So composite veneer is a little bit more complicated than just the bonding. It's still some sort of bonding because it's made out of composite, but it's a little bit much more complicated. And of course, the cost is a little higher than just bonding because there is a lab involved in this. But it's still an option if you really want to close the gaps and you want to, do it like in a professional manner. So this is an option as well. Other than that, the dentist can do it in the chair side. If they're very experienced, they know what they're doing. It's just going to take a longer time. So maybe a couple hours, sometimes even more, because if they are very, finicky about it and they want to make it, the best, so that can take a little bit of time. And then after that, we use that ultraviolet light, the blue light that we have, just to cure it, and we polish it and we make it kind of glossy. We can apply a very thin layer of resin on it to make it shiny and, to make it look cute. So as I said, it's the cheapest procedure in cosmetic dentistry. It could be cheaper than whitening, not like whitening strips, but I'm talking about like, the in office, the professional whitening. And also it's done in like a one visit. If you're gonna do like, fix a little chip or something, on the side of the teeth, no anesthetic, and it's very simple and straightforward procedure. However, some of the problems that comes with composite bonding. First of all, if you have a pretty heavy bite, so let's say you have a little bonding on your front tooth and you forget what the dentist said and you go and you bite on something hard on that, it's gonna come off. It will come off. So we always say, if you have a bonding on your front teeth, make sure you bite on the side, on your canines, or you cut your food in small pieces and chew in the back. A lot of patients, they forget about that because, okay, it looks like the teeth, we're happy. And then they will go and bite on that. So that can chip it again, can remove the bonding. Second, if you have some on the side of your teeth due to gum recession, and you don't wear a night guard, and that's usually can happen if you brush a little too hard, but mostly also if you grind your teeth. So you're basically putting a lot of pressure on your teeth. So what happened is the thin area where the enamel basically start to meet the root. So you have a root, then you have the tooth. So the enamel becomes really thin at that little area. And the enamel starts to chip away from grinding, from putting excessive pressure. Then it starts to chip more, and then you brush hard, so it chips even more. And this is basically what starts to happen, where you can start to see those tiny little V notches around the neck of the tooth where it meets the gum. And we call it abrasion. And this is because of you're putting too much pressure, and you go and you brush a little hard using a medium or a hard toothbrush, which you should never use. Always use a soft or even an extra soft toothbrush. So it removes that protective layer, and we end up with this. So, okay, you went to the dentist, they fixed them, they put them, they look fantastic. You're not using a night guard, and you go again and you're grinding very hard. So what's gonna happen? Those fillings, or well, the bonded parts are just gonna start to pop. And you go again to the dentist, what's going on? I got this fixed. You have to fix the problem. And the problem is, if you're grinding, then you need a night guard. If you're grinding because of an underlying problem, which sometimes it could be sleep apnea, that has to be taken care of immediately. So a lot of the problems with grinding, I'm off of the subject now, is really because of sleep apnea. So how do you know if you have sleep apnea? If you're snoring at night, does your partner tells you, okay, you're snoring, I can't sleep, this is too much. If you wake up, you feel tired. Well, you know what? How about you maybe record yourself while you're sleeping, like put, the phone or something. And if you feel that if you hear yourself like snoring or waking up like multiple times at night, that could be a sign of some sleep apnea going on. Of course, you have to go to see a sleep doctor, and you have to get a sleep study done. And the dentist can actually give you a referral to go get, the sleep study. But what I'm saying is there are certain features. Your muscles here are very big and prominent. Another big one, look at yourself in the mirror, stick your tongue out and try to say, and if you can see a little space in the back, I think you're okay. Well, of course, ask a dentist or go check with your medical doctor or your sleep study. I'm getting a little too technical here. But what I'm trying to say is grinding could be because of an underlying sleep apnea. And a sleep study would help you to say, yes, we do have sleep apnea or no. But it also, the pressure that you're putting can make those little bonded areas just to basically start to pop. Another big problem with bonded teeth. So composite resin is very different than the dense porcelain. And why is that? Because the material itself, it has micro pores in it. So it can retain stains. So you get a nice bonding, it looks fabulous that day. You go, you start to smoke, you're drinking coffee, you're drinking tea, and then you come back in your 6 month and it's like, it's getting darker. I don't know why this is happening. It was nice before. Okay, well, because it can retain stain. It's very different than porcelain. So we need a little polish a little bit, but when smoking too can kill any nice, beautiful bonding there too. So make sure maybe think about quitting smoking. That would be fantastic. Or coffee, tea, maybe use a straw. That helps actually to stay away from the teeth. Or just you're gonna have to get it polished every now and then. So this is one of the big problems. Then, as I said, you can have the beautiful, most beautiful bonded like front tooth, and then in a matter of few months, if you're drinking coffee, tea, wine, red wine, smoking, it can start to change the color. The other part is it's not as durable as different materials, so it can pop, it can break. If you bite something very hard, it can crack it. And you know, this is a problem because the material is not as strong, it's not as durable. It's a nice, you know, it's a nice cheap procedure, but of course, you know, it doesn't last as long as the other procedures as well. And it's not really ideal also for all the teeth. So let's say you have a big crack in your front tooth, not a small chip. Remember I said if it's like maybe 1/4, we can fix it. If it's a bigger part, then bonding is not gonna really help you. You need something stronger because not even a veneer, you need a crown. Because when you are chewing, you wanna make sure that doesn't pop. Or of course, if the nerve is involved, that's a root canal and then a crown after. So you have to be just aware of if you have bonded teeth, be careful when you're biting down. Okay, we're gonna cut the food in small pieces or bite on the side of your teeth, on the canines or, you know, the premolars, or just cut it and chew in the back. Of course, no, try to open a bottle with your teeth. Like, you'll be surprised the stories that I have, a lot of stories. And of course, you know, a bonded tooth, you treat it like a normal tooth. So you need to brush, you need to floss. When I'm flossing, I'd rather just put the floss in and clean and pull it through. And of course, you're gonna brush twice a day, you're gonna floss once a day. And also you need to start scraping your tongue as well. We have tongue scrapers in the office and they work phenomenally. So sometimes some patient would come and say, I have this bad, you know, taste, my mouth, I don't know what's going on. And then their teeth are okay, they're brushing and flossing, but the tongue needs to be also cleaned up. Sometimes it could be something underlying like a sinus problems or allergies or stomach problems or acid reflux. But really, you know, tongue scraping helps as well. I mean, how long does it really last? So bonding can last for as long as you are really maintaining it. As long if you are grinding your teeth, get a night guard or get a dental appliance or get a CPAP if you have sleep apnea. If you are being careful and not biting, you know, like too hard, no chewing ice, definitely. No biting on very crunchy like chicken bone. That's gonna crack your natural teeth. Not forget about even the bonding. Natural teeth are gonna be gone. This is when you come to me and I'll be like, okay, now we have to fix it with a bigger something. Also, anything that can affect the integrity, don't hit it with a spoon, don't hit it with a fork. Just be careful. You have beautiful teeth now and we just need to maintain them. And as I said, maintenance is gonna be the brushing twice a day, the flossing, put the floss, pull it through, tongue scraping, and maybe you can rinse with a little bit of warm salt water. Any mouthwash is fine too. Some of the mouthwashes can stain your teeth though, so you have to be careful about what you're using as well. And so the difference now between dental bonding or teeth bonding compared to a veneer. Let's start with that. So the veneer is a little bit more complicated, more sophisticated process because we have to roughen now the whole outside surface of the tooth to create that tiny thin 0.3 millimeter to be able to put a porcelain on top of your tooth. The dental bonding is different. The dental bonding, we don't really touch all the outside of the tooth. We just go where the little chip is or the crack is. And sometimes if we have to do like a composite veneer, we might just roughen, but not as much as a dental or a porcelain veneer. But porcelain veneer are more durable and they are stain resistant. So you don't really need to do whitening with them. It's just your teeth are white and you're done. Of course, you have to wear the night guard too. Very important. And what's the difference now between a dental bonding and a crown? So remember, the dental veneer, we shave the 180 like here, just a tiny bit, very tiny, roughening the surface. The crown, we have to go all around the tooth. It's 360 degrees. And depending on the material, it's gonna actually tell us the thickness that we need. If it's porcelain, full porcelain, it's gonna probably be like around 1 millimeter all around. If it's metal or zirconia, it's a little less. But they're much more durable. And they work also in people, you know, with very strong muscles, heavy bite. If you have a deep bite, then you definitely need something strong. A chipped front tooth, and you have very strong muscles and you're like grinding hard, it's gonna come off like in a matter of whatever. But anyway, so I hope you understood now the difference between a dental bonding or teeth bonding and dental veneer and a dental crown. Now, what's the difference between a dental bonding and a cavity filling? It's the same material that we're using, but different perspective. So a filling, because we put a filling because there is decay. So we have to go and clean the cavity in a certain way and then put the filling in it. A dental bonding is not because of a present cavity. Bonding is because we are trying to restore the tooth back to the original form, or we're trying to change the shape of the tooth a little bit by making it a little bit wider to close the gaps, or, you know, if there is a black triangle, to close that a little bit. But it's not because of a cavity. So this is the difference. However, the code that goes to the insurance is the same. And that's why it gets covered by the insurance most of the time. Of course, unless if you have like a very weird plan. But these are really the differences now between the dental bonding or teeth bonding and a dental filling and a dental veneer and a dental crown. And sometimes, as I said, if I tell the patient, you don't have cavities, but we're gonna do some bondings, and they go outside and it's put in as a cavity or as a filling, they're like, but she didn't say that. This is what the dental bonding is. Maybe next time I should explain that more often to the patients. But now at least you guys know. A dental bonding is pretty much the same material that is used as for a cavity. For a filling, we just have to use the same codes, but for a different reason. Okay? I hope that was enlightening, and I hope you are enjoying your day. And don't forget, you have to keep, taking care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.